Hello, my name is Jennifer Nelson. I'm here with Physio Partners to talk to you about bruxism. Bruxism is characterized by repetitive motion of the jaw muscles, and you'll notice that you might have some bruxism if you are clenching a lot, grinding your teeth, thrusting your jaw or tongue forward, or bracing your jaw. This can happen at night or at day or during the day. This is a disorder, it is not a disease. There's been a lot of updates in the research over the last 7 years to help us understand bruxism. And we know that it's pretty common for everybody to do some of these things from time to time, but just like anything else, too much of anything is not a good thing. Unfortunately, there is no set standards of what is too much or too little of muscle activation that could cause some problems. Some problems that you might notice if you have bruxism are headaches, eye problems, shoulder pain, neck pain, tooth pain, tongue problems, swallowing problems, or even your dentist might have mentioned something about your teeth. If you have been treated by your dentist in the past for bruxism, you may have been given a splint to try and work on your occlusion or the way your teeth fit together. Current research does not support the practice of adults using a splint to change how their teeth come into contact for bruxism, but it is very important to protect your teeth from the wear and tear that the increased contact can cause, and so a night guard is commonly given and is something you should look into. There are some ones that you can buy over the counter as well if you aren't able to get to the dentist. But if it's not fitting very well or you're uncomfortable, it's a good idea to go see the dentist because they can make a lot of fine-tuned adjustments to the splint to help you at night. The most common cause of bruxism is stress. And one of the things that we can help you with is learning to relax those muscles in many different ways. One thing that you can do is to try the wiggle exercise, where you just take your jaw and try and wiggle it gently whenever you notice that you have some tightness in there. You want to do this as soon as you notice that you have any clenching, bracing, grinding, or thrusting of your jaw, and jot down when you notice these activities. And then ideally you want to start to look for some patterns so that you can do this before you actually start clenching or grinding. Meditation and mindfulness is another good way to work on relaxation, since stress is one of the biggest triggers for bruxism. There are many other ways that you can work on relaxing these muscles that physical therapy can help you with, including breathing problems. We have noticed that bruxism is closely and commonly associated with people who have breathing problems while sleeping. This is important to discuss with your primary doctor or dentist, especially if you have any snoring or fatigue, especially when you wake up in the morning. These are signs of sleep apnea, and oftentimes it's very mild, but this can be treated with a CPAP, or there are some other techniques that you can do with physical therapy to work on your breathing. The most common thing is to sleep on your side. This promotes better breathing rather than laying on your back. If you have some shoulder problems, you can try hugging a pillow to try and take some of the pressure off of your shoulder and put it more onto your chest as well. Bruxism can also happen if you have an underlying jaw problem in the temporomandibular joint. You'll notice that you have some difficulty opening your jaw, or pain with eating, yawning, talking, or you might have some clicking or popping. These are all things that physical therapy can treat as well. That's all I have for you about bruxism today. So if you have any questions, please don't hesitate to comment below, and feel free to call us if you would like to try and schedule an appointment or learn more about bruxism.